In the fourth and final section of our lecture, now we will go over the investigations of stridor. And then when we will discuss the investigations of the stridor, we will again focus on history and clinical examination. As I mentioned in the previous section also, history plays very important role in finding or in reaching the final diagnosis, or we can say the differential diagnosis or probable type of diagnosis, provisional diagnosis in the exact words. So provisional diagnosis, history is important in reaching the final provisional diagnosis. So how the onset of stridor occur, that gives the idea that might be patient is have some foreign body in the respiratory tract that is cause of the stridor, or any injury, trauma, any inflammation. So onset, duration, mode, asking these questions in the history is very important. Then also clinical examination, direct laryngoscopy, and also bronchoscopy and microlaryngoscopy. All these different scopies to visualize the larynx, bronchi directly, and finding out the cause of the stridor. So the investigations of the stridor, again, history and clinical examination. The X-ray is also very, very important in finding the cause, if there is any mass, neoplasm, any foreign body present, that can be easily detected by the X-ray. Dictate type of test. Soft tissue lateral and PA view of the neck, lateral and posterior-anterior view of the neck, chest, X-ray of the neck is important in finding the cause. X-ray chest in PA and lateral view. Diagnosis of foreign bodies. Then we also have like fluoroscopy of the chest. Fluoroscopy of the chest, diagnose radiolucent foreign body. So any radiolucent foreign body is detected by a fluoroscopy of the chest. CT scan, which is mediastinal mass and congenital vascular anomalies, can be detected by the CT scan. If any mass is present that is causing compression, that can also lead to stridor. Then angiography, visualization or graph of the blood vessels for vascular anomalies before operation. Esophagogram for tracheobronchial fistula, aberrant vessels, esophageal atresia. So all these are the different tests that are used for finding the cause of the stridor. Direct laryngoscopy. We use the laryngoscope and for examination of the larynx, direct, and this is performed under general anesthesia as compared to the flexible fiber optic laryngoscopy that is done under topical anesthesia. So under general anesthesia, we do microlaryngoscopy and bronchoscopy. Resuscitative measures, monitoring for oxygen saturation, pulse, blood pressure, and electrocardiography. Direct laryngoscopy, anesthesia expert is required. Whenever we give the general anesthesia to the patient, we need the anesthetic specialist or anesthesia expert, because sometimes wrong anesthesia can cause serious complications. Induced with insufflation, IV route is established and patient kept on spontaneous respiration. Bronchoscopy is examination of the bronchi using the bronchoscope. You can see the bronchoscope. Bronchoscopy after laryngoscopy, examination of air passage, looking for any obstruction in the subglottic or bronchial, secretions collected for culture and sensitivity, crust and foreign bodies removal. After bronchoscopy, child is intubated, and examination of larynx and esophagus. So bronchoscopy is done for examination of air passages. Secretions are collected during bronchoscopy for culture and sensitivity. Any crust and foreign bodies are removed. After bronchoscopy, then child is intubated. So all these are different steps that are performed for bronchoscopy. Microlaryngoscopy. Micro is small, laryngoscopy is for examination of the larynx, done without intubation. Patient on spontaneous breathing and oxygen, gases delivered via catheter, laryngoscope. Magnification is done with the telescope and microscope. So that's the microlaryngoscopy. The magnification is done using telescope and microscope for magnification. Treatment can be planned after diagnosis. So that concludes our topic of congenital abnormalities or congenital lesions of the larynx and stridor, in which we discussed in detail the causes of stridor, the management of the stridor, examination of the causes of the stridor, and how we can treat this condition, and what are different congenital lesions of the larynx. So that concludes our lecture of congenital lesions of the larynx and stridor. Thank you for watching sqadia.com.